Hi, welcome to this month's From the Desk of. I'm Aaron Gerds. I'm the editor-in-chief of ASH Clinical News. Well, it's March. March Madness is upon us. And although we talk about the basketball tournament this time of year, madness has probably been around for a few years now. I'm referring to the pandemic, of course, and how the pandemic has accelerated changes in our field. One of the areas of change that is really palpable, both in hematology and across medicine, is how the discussions between doctors and patients are conducted. Vaccines in themselves has really become a touch point for that idea, where the public often views recommendations of vaccination quite differently than maybe physicians or healthcare providers do. And this has really built a lot of tension in the public, in the medical fields, and in individual relationships between doctors and patients. Why has this come about? Well, this certainly isn't anything new. Many of us can recall instances where we've recommended treatments to given individual patients, and they've declined it, or even flat out told us we're wrong, and have gone on to seek other options. But it definitely seems to be more pronounced now, particularly again with vaccinations in mind. Has the internet changed anything? This wealth of information that people can access, whether it is rigorous or not, backed up by other data or not, or widely accepted or not, is out there, and it is part of the reality we all live in. I think it also brings up a lot of concepts about how we use words. You know, when we say research to a patient, is probably different than when a patient says that they've done research and looked these things up. And opinion too. When we say opinion, it means probably something much different than when a patient says opinion. And these two discongruent ideas of how we use these terms and how we view data and results and vaccination, the utility of these things, really put things at odds. And ultimately, though, since this is nothing new, this is something we need to move through. And what are some helpful tips that we could take home with us to help bridge these conversations and come to a good consensus on how to move forward with an individual's treatment, I think are key pieces of all this. So in our feature article, we're going to unpack the idea of physician-patient communication within the special context of vaccine hesitancy. Also in this month's edition, we are going to dig into the ASH guidelines, brace yourselves, to discuss ultrasounds, Doppler ultrasounds that is, for heparin-induced thrombocytopenia. In particular, is 4 extremities better than 2? So we got a great debate into that item. And of course, we have all of our normal features, literature scan, societal updates, as well as latest and greatest, the news coming from the world of hematology, all wrapped up into our March edition. So this will be coming out both in print and online. Hope you enjoyed the read. And until next month, keep the blood pumping.